Pulem from Well Body Ministry for talk about different things them around the well body issues. But then one message again will still try for continue for reinforce now on this cervical cancer because we know the cervical cancer now one part of sickness we the country they live with, and as we be done the talk previously it affect plenty of we women them in Sierra Leone, and so as a result of that, we want for talk to Wuna about waiting and waiting we need for do. But now we don't already know say cervical cancer. Now one part is cancers them we it men or it prevent we can able for prevent them, and of course one part of prevention strategies then what we get now for maclate people or picking them we not exposed to the virus it because we don't talk about say now one virus they cause we not the HPV or human papilloma virus, but before girl picking exposed to them they need for get maclate where that maclate they of course now they affect the body so jaman them so that if the virus is exposed to the virus you know go get them. Now that's now one of the effective most effective strategies them for prevent cervical cancer. And then of course because of that for picking them we they below the age of 11 where Sierra Leone currently the vaccinate when a 10-year-old girl picking them the parents them or we the mama them, the mama them and the pa them actually get a very critical role for play for make sure say the picking them take that maclate day. And waiting at this critical role here where the parents them get for play. Now that's the one for really can talk about now this program here so that when I go here and when I go able for support the girl picking them we now the 10-year-old girl picking them we eligible for take this mark later so that then go take them. So with me at the studio I don't joined by two well body master sabi people them from the Ministry of Health and the different programs them the expanded program on immunization and the health education program. We want for can tell we about waiting the mommy them and the parent need for really do as a support to the girl picking them we all 10 year for let them take this mark later and why they need for take this mark later, waiting at the health benefits them to the girl picking them. Now that's we can talk about now the program, but before we proceed I go on for let me guess them introduce themselves now the studio. I will start with you, sir.
Fambul una kushen kabo mina Ibrahim Soiko uma senior health promotion officer na the Well Body Ministry.
All right, yes ma'am.
Good evening, Fambulde. Mina Amanda Clements, the Social Mobilization Coordinator for EPI Expanded Program on Immunization.
All right, very welcome Amanda and Ibrahim Sori. We will not join we at the program today for talk about this very important topic here. So of course over the period like I say we don't talk about a lots of cervical cancer, within a cervical cancer, how for prevention and all of those things. But probably for the person we in first time this for join we in the program or for listen to this program here or for even hearing about cervical cancer or about HPV, you want for really take people through about within a HPV, what it cause them and what it lead to and probably how for prevent them.
As we already hear, HPV we mean human papilloma virus. Now like some kind tumbu, we can go inside picking them or big person, and when they're infected, then they get one pandemic, then we then call cervical cancer. And we know say cancer na thing way really bad because sometimes if you not catch and quick, you they die with that cancer day. So as well body people them we they come for cancer prevention better past cure. Because we know say we prevent something, it not go and bug you where you go before. So for the Well Body Ministry under the immunization sector, we get one vaccine what we call HPV vaccine, and that vaccine day where we give any picking 10-year-old girl picking, we all 10 year, and they protect them for long so it no go get this cervical cancer. So, and last year we been do a vaccination of picking there we be all 11 year to 18 year because we don't see say this year so can they incubate pamposin, and if they not catch and quick now so most of the mama then can get the cancer and then can die with the cancer. So because the well body ministry no wants for see down day, they make we do a vaccination for over 1 million pikin them. We've been successful last year inside November. And we vaccinate all them pikin them we go na schools, pikin them where they universities, pikin them we know they go school at all, within our communities. We've been vaccinated them all and have been over 1 million girl pikin they now been vaccinated. But currently, as a routine, we get this HPV vaccine when for 10-year-old girl picking them. Then can go take her at any hospital where they give vaccination. You, mama, you can just walk in and care you 10-year-old girl picking say, I can't for make it take the HPV vaccine for make we tap cervical cancer na salon.
All right, plenty thank you, Amanda, where you don't take your time for really summarize within cervical cancer, within cervical cancer they lead to, and of course how we were able to prevent them, and even some of the efforts them we don't undertake previously for prevent cervical cancer among girl picking them, and of course the continuation of the efforts then they wanna still they do for make sure say we girl picking them na mama salon able to be protected and prevented against cervical cancer. Continue for stay with we, Amanda. So we come to Ibrahim Suri. Ibrahim Suri, why should they talk around all of these for vaccinate girl picking them and all of those things with the HPV vaccine, with the protect girl picking them for letting not get cervical cancer? Waiting or how crucial or critical the role of the mommy and the daddy then, or anybody when an elderly person we get girl picking of 10 years where they take care of them, how critical then role they for make sure say them picking then take cervical HPV vaccine?
Okay, that's a very good questions, because the role is very, very much important and pivotal. But before I go to that question, please just allow me like a little bit of background because let people know the context.
Okay.
Yeah, because if you know the severity, you will know the actions, you will see there is need. All family know say cervical cancer because people can mix up HPV, cervical cancer. Okay. First of all, when they say HPV, human papilloma virus, now the tumbu, you understand, where they lead to the cancer. The tumbu they don't na your body na this woman in cervix, they sit on the na usa in bomblai, that in woman side. Now they sit on over a long period of time. If your actions do not be taken, that is to say, if you not go do screening, do not fail not say the security, then treat them and all, over a long period of time, now they turn to cancer. So now make for we whether in public health we can say now a disease of two sides. You get the infectious part, you get the cancerous side. We mean say now communicable and non-communicable diseases. So now coming back to your question, we all know say we parents and they're highly influential in our lives. From when they're born with it, they will cow up. Now they give you first education, give you first civilization, socialization and all. So they play picky role in our life, be it education, be it the kind of food they eat, be it even health. So now make we think to say we parent them. What they say parent because now they talk of gender sensitive risk communication. What say parent no means that the woman no more. You understand? The part and self. Now they talk of man kumra. What they say kumra na male and female. So we think to say a big role for play because now I don't know now. Let's just give this background. We don't do one vaccination somewhere in other district. I know one for call the name. Where we give is it MR when on measles rubella vaccines. We give a community. Yeah, the woman are twin and born. You understand? We approach them for give the pikin immaculate. They say no, we not do them for give the pikin immaculate. We say why? They say that daddy don't give left message say no for immaculate in any way. I say why? He say no, personal call it daddy. So he give you the number we call it pa. So as we don't talk with the pa na phone. Nice you not give me woman the number. As you give the woman who talk to the mommy. Nice you not immaculate the pikin them. Now picking the pa na born the pikin. So you see the influence. So they get big role for play for ensure say we picking them get immaculate and get well body. You understand? Without them and office because the pikin is small, the young they will take decision for themselves. Anything we get for do their health and their well body. Now their parents them be it the mama and the papa or family members then they take decision. So their role for ensure say the pikin gets the immaculate the way it need, the well body way it need, for childhood development is very, very much crucial. And we think so they get big role for play the part they want, therefore able to ensure say they follow up, they get interest in the picking well body. Because the mommy always go and get interest, but sometimes they get demotivated. So the part them we need expect them for the support the woman they want if they need transport. You forget the woman if they need support, sometimes they even go left in a clinic. That is a motivation. And now well body woman don't make it easy. As they see man go with human in a facility, in a clinic, and first they call. For example, if you get 10-year-old pikin, you can't go now in a facility. You the pa we can go that pikin, you force they attend to. It's that's motivating. You see, so all of this we think to say they get big role for play. One for level we say pikin and get the market they need. Two for level we say we will get USA would go away with the say for level able to achieve universal health coverage. And Maclate vaccination is a crucial part for less salon able attain that position for level get universal health coverage.
Okay. All right, continue to stay with we Ibrahim Suri. So Fambul, when I don't get them very clear. We picking them, I mean, where they grow up, one of the things then we always rely on, or people that will always rely on for information and education. Now we family members, that we parents them specifically, and of course, inside salon we don't say until somebody reach 18 years, in not able for give consent for himself on certain things them, so including access to certain health care programs them, like a vaccination. So picking away the 10 years, you no get that power, that authority there for say yes, me I don't come for level I can calculate me. So you as the parents, now you now the pillar, now you know that strong person the way go say yes, this na me picking, now for vaccinator, now for maculator, when I maculator, so that you no go get this sickness here. Because like I would don't say, tumbude when the human papilloma virus, that tumbude it cause one bad sickness na the body when a cervical cancer. And if you get cervical cancer where you don't reach a certain stage, it go hard for men. And it will cost you a lot of things, you know, your time, you know, the well body where you no go get. I mean, so for that we able to prevent that, the government say before person don't get before person get the human papilloma virus or the tumbu, we na vaccinate and we na maculate them, so that even next time we go probably get her now, that maculate they go dey inside in system, so you go fight that tumbu dey, so that the tumbu no go get that cervical cancer. But the pikin himself as a whole, 10 years, you know, go work na any health facility or any clinic and say, I don't come for level, can maculate me. Now you the parents, you the mama, and you the papa, now when I get for support, and one of una, either the pa, you know, if you see say the woman too busy, you the pa take the picking, let it go down, the girl picking specifically, at the health facility where they near una, for let them vaccinate her. Let them get on this mark later. Or if the part too busy, the mommy, you say for now to go come to an agreement, say tomorrow morning, they go take Fatu, they go Fatu na the health facility or na the clinic now, let them go get on this mark later. Let una agree so that una go able for go time. Now una go give that consent, that authorization, say let them get. So that is very important. So if una not agree for let them get on the market, that picking they go miss that market day. So say 11 years, and with 11 years, the possibility for let get that market day is very, very, very slim. It's very, very slim. So whether that you girl picking they turn 11 next month, or 11 the other months, make sure say before it reach 11 years of age. Once you done 10 years, make let them go get that market day. Una not left for draw till they became past that age day with the get the market. So now one party, very, very important rule that day where we as the parents them get for make sure say we girl picking them gets the market. So we come back to you, Amanda. So we don't talk about this market here that let people them go with the girl picking them, whether you small sister once you don't pass 18, you know, or once now you not the auntie we they take care of that picking day, or once now you not the mommy or the pa we born that picking day, we they encourage them for let them take them girl picking them at the hospital, then we they near them for take this market here. But EPI na in responsible for market business na this country here. Not only the HPV market we talk about now, but every other market. How wanna they ensure say this market here, it in every government health facility right across, so that so it's Kumbra hearing this message here today. Maybe tomorrow morning take that 10-year-old girl picking they go to the health facility, it make sure say it go get them. You know go get for pay or that transport back for go and then tell and say go come tomorrow or go come the other day.
one unit we call the logistics unit, and inside the logistics unit the main work now for make sure say all of vaccine then at the one whole country, not to just for HPV vaccine no more like you don't say, but especially HPV vaccine because we don't see say cervical cancer bokuna the country, so we really they put emphasis on them because instead don't be routinized. So we they ensure say all the PHUs that what they work with 1,500 PHUs that what they work with, they all they get HPV vaccine in then stores them. If they go low on stock, then they reach out to the EPI headquarters and the logistics unit same way so go do another transfer of vaccines to them one day. So it is very important for we because we don't want to make you go outside where they provide service and you not receive the service where you come for. Because one of the things we can frustrating now you go the thing where you want to know the day. So now make we they ensure say every facility where they give immunization, where they under the government, they all they get this vaccine. And for make we do small more partner, they will get what they call say where they do private partnership. Also, they want the way na hospital they we know they under the government directive on a private institution, but in same way so they do immunization where they try for bring themselves under because we don't want some man and they go na yard they no get them and some man they go over yonder they no get them. So we they try for bring all man on board for ensure say immunization is done in as many hospitals across the country as possible because we can say prevention is better past cure.
All right, plenty thank you, Amanda. So I come to you, Ibrahim. Sorry. So in terms of the rumors and misinformation where some people and they then just believe say they know everything. We see in fact we see the area about Macleat's business, their mind don't wrong go to plenty thing. And one part the thing we plenty people they talk, especially at community level, now that Macleats for girl picking them, they make them for let them not born plenty picking them. You see, if now 5 picking being for born, so now 1 or 2 no more you go born. So that they use and say then they talk and say now as a means of for control with population of the birth rates. We think now the message we want for really send to parents them about the benefits of HPV Macleat and for give them the right information we they need for know about within this Macleat.
Yeah, I like the way you put benefit because when we do health promotion communication within the support somebody within the you action for let you take action and something for your health now where you see the benefit, see the need. Yeah, so there are a lot of benefits. One, you know, say most of the time we can promote the health benefits. We Amanda said don't start and say when you pick into the Macleat, it go tap, you know, the tumu, you understand, for lead later to cervical cancer. You understand, and then not just the tumu, the tap. You understand? So there are a lot of benefits, just as they say. You know, one, you know, woman specifically they expect it for born picking, you know, but if you get for example you get cervical, you get the HPV virus, you understand per you, then later it lead to cancer, they need born picking. Then a big disadvantage to you as a woman, right? We don't see usai and cervical cancer, you know, they lead to certain situation where, you know, so women they lost their homes, they lost their marriage, you know, they point finger in a community, there's communicated in a community, they call their names, you know, in the olden days they say that then associated to spirits, witchcraft, not to witchcraft, you know, now to move, now sick they cause them. We make that woman day, you know, you do mommy and daddy business safe, you know, it's painful for her. You understand? It full bad water, you know, it feel ashamed of his, you know, get self-esteem. You know, and because of that, woman sick is sick. So but now Macleat they with the tap that sick. Macleat will not make woman they suffer from that sick day. Macleat will for tap them. And I can tell you, according to the recent study we don't see from this cancer registry, soon we know say all the effort they do, we know what they reach under. But cervical cancer, they are about for topple breast cancer, we na the #1 killer, you know, cancer na Sierra Leone per woman them. You understand? We breast we cervical and the second. But the data we they see now, it go be later. You know, but not all be done because I make do all I want to say here. I make papa government, but means to EPI. Don't call them Macleat for picking them within a community for take them so that you know will be that kind of situation. And lots of benefits they way the Macleat get. One, it tap the tumu. It ensure lifelong immunity. We mean say when you take the Macleat, till you die, you know they ever get that tumu, what they cause cervical cancer. Two, It go sure say you get. I don't go say well, it will make you get a protected home, but you not go be in a situation where me say man go grab you, or man go ignore you because of you get a cervical cancer sick. You understand? Eh? You model no go point finger by you, na community. They not go push you by you. Not go be that kind of stigma. That's the first people they get. I remember where we do that cervical cancer, commemoration. Once somebody come, one woman, a champion now, for cervical. He explained a lot how he suffer, through in the hands of a man. I man ignore him. How the family ignore him. How he picking and push away from him. You understand it? When now just one sister and I be there with him. It did to a point where he almost lost in life. Now courage. Now I make it be so to they give in testimony. So I don't feel say woman and go on for in that situation. I don't feel say me and you man and say oh sister don't go in that situation because it's so painful. Because now you can take action. Teenage will go tap that kind of situation. They not be to mama. They not be to sister then tomorrow.
All right, plenty. Thank you. Really. Like the passion, I see the passion in you as you really try for educate with people for let them really see the reasons, because some of them miscommunication or some of them bad rumors and they will can just the pass and spread no more, then false information, in fact not to even a rumor but false information who can go and spread to people because we take advantage of little exposure to information as against the majority of we fambu them, especially we parents them out there. We can want to take advantage of that and give them the wrong information out there, which is really, really bad. Now, sorry, don't tell we about some of the things then. If you not take this mark later, what are some of the things then we could get? One, as a woman, you could begin to pull bad water. So anyway, see begin to pull bad water, and say what again, they begin to get pain where they do mommy and daddy business. You something way for enjoy, and then you begin to feel pain where they do them. Then that bad water they get some kind bad odor. You say ben, how you would feel like you pull some kind bad water where like you get very bad odor, something where you wanna for enjoy, they get pain, yourself to yourself, how you could feel. Then now let's talk about the man where you could be proud for say this na me man. Where something like where for instead for enjoy like they still feel that pain or that bad water, they really mourn around the moment when I start that process it begin to feel like it discourage all. So before like you get to that kind of stage they say make sure say you picking, especially the one where not start for do mommy and daddy businesses. Where they 10 years now they don't put the age limit down to 10 years so that mostly before by the time we go don't start for do that mommy and daddy business, the way go be more exposed to that tumbude, they don't get something inside in system where they fet that tumbude. So that even if you get the tumbu now, in the tumbu not go get power over your body because already something they protection where they protect them, where na this mark later. So this is not sound like the other sickness and the way that they tell you say wash hand with soap and water for let no get a no. This then say maclate. And this maclate where they take care, like how Ibrahim Sori say, they give a lifetime protection. So for a very, 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 very long time. So which is really very, really, really, really simple and easy for we. And governments don't make this maclate say now free. You not going to pay nothing to nothing for them, So, and if you not take them, the possibility, in fact, science they say, woman, it gets about 80% chances for get this vaccine, this tumbuya when the HPV as long as it live. So, the most effective way for prevent or protect yourself from her are the maclate, and government don't make them free of cost for you. So we don't want, like how Ibrahim Sori say, for anybody they into that kind of situation there. So it's at your advantage for let you make very good use of this particular opportunity here, where government and the well-body partners them don't give to we all. Okay, so now then discussions and they we talk about, but also maybe Ibrahim Sori don't talk in a man. So somebody go say, a man they talk so. But now maybe Amanda, you as a woman, you say go on for really reinforce that message. Let them hear him again from you as a woman. Let them really know say this is not about men talking to women, but let it also be woman talking to fellow women. Waiting now some of the things them we want for address based on them people and they way they no feel say na then BBC na then sabi all the information where they pass then false information then they to fambu them.
So we the advocates for make woman and man they work together. And una they work with we well one. Una self understand the problem them and una self they advocate on my behalf. So me want for say no scientific evidence no tell we say where any picking take this maclate, you no go born the number of picking the way for born. We not get no evidence and medicine where they take on based on evidence. So then they watch the medicine after some time, they don't do all the trials there on this medication. Even before it can salon say we been get some small trial. Now one pandy partner na salon, we been get some number of picking the women take this maclate. And years after the picking they so healthy, they're okay, no problem, no don't happen. And this maclate don't then at this country past 2 years, past 3 years. So we get a lot of evidence for sure say nothing no go do the picking them, and then go born the number of picking them waiting for born, and not to salon no more that they take this HPV maclate. It is all over the country, all over the world, sorry. Not to salon no more, then in West Africa, then they do themselves in other countries in Africa, East Africa, and other places, even in the US. So not to we no more, no they not say the maclate within the giving a salon and a third hand, it is the same vaccine. So make we not afraid say waiting they take over and nothing we they get now. So because the well body ministry want for make we get the thing away good for we they get people them from out of the country where they help we when a Gavi the vaccine alliance and then they give them medicine there so and then same medicine where they give it, then they give other people in other country there. As a woman, you know want for them in that situation where you pick in get for the strain and suffer. As mama, una no like for see una picking and the strain and suffer. As my brother don't say, this tumbuya so it incubate na your body. It did in your body for almost years. After you don't reach then 22, 23, nice one say you go begin see evidences of symptoms of this kind of thing there so. And when person don't reach that side, it just feel by like nah medication. If they find and quick, then go medicate you and you go well. But if they not find and quick, then a day you go begin get the bad water and all the other thing them. And as women, we like for stand tall and we like for put we shoulders then up, say we are capable and we're able. And one way for do that, then I forget well body. Because if you not get well body, you know they're able for do nothing. So we the advocates for with small picking them. If you know say you get picking with 10-year-old, now you neighbor in picking, now you brother-in-law in picking, and you sure say then go and go take this maclate. For you we don't pass that age day, go na hospital then may you go begin do screening. We know say some man they like me age, they go down say we don't pass that age though. What we go do for we go na hospitals, them all government hospitals, then they do screening and are free. If they catch the tumbo na your body, then go begin medicate you. And if they begin medicate you on time, you go well. So we they beg una all where you get picky way all 10 year, you carry them go na hospital, we then get the maclate, you we don't pass 10 year, approaching 20s and above, you go na hospital and you go they do regular screening for ensure say you don't get the tumbo na your body.
All right, plenty thank you, Amanda, for that very, very brilliant response and reinforcement of the message to we mama and papa them and to everybody where they listen to this message here or to this program where they watch we live now Facebook and of course where they get we live now radio for say once you don't get the message, now we learn for the past the right message to the right people them. Ibrahim, sorry, why probably yourself want for add small thing to that one day? How you want for why should they do that one day? I also want for you help with fambu them. How for really learn for verify certain message information the way somebody go can't tell you. How you go really ask the next person for let you confirm because the other time I know say we people I'm like oh they grow up. If I can't show me mama results for say mama I don't pass, they take that me result they go show something 4 5 different people you know so it go take me word for say okay I don't really thank you congratulations but until you get that confirmation then they, from other 4 5 people in that community the way you know say then land book pass me they understand pass me before you go can't tell me thank you fine one. So how you want for let we people as well take that culture there for verify information.
Okay, so I will come to that question, you know, because it's very important, yeah. You know. But quite apart from that, I hear Amanda talk say, you know, say science, no ever show say, you know, we picking take the maclate, they make it not get born picking, and that's so true. You understand, eh? I'm not saying put in the English context, but we now we say, science, now we the look, say this, not that, but we now, so I just want to give people one example. This, you talk, say, the maclate don't to another country them, in the world, even Africa.
Yes.
And I can tell you, say, one country we introduce them, we in Rwanda, because we introduce you in 2022. Rwanda, they don't introduce them before we. That what is the rumor where they pass now the opposite. You understand? I will get Rwanda. When they introduced the HPV maclate at that time, at least 9-10 years, something like that. So let's say 1 year or 2 years down the line, them picking the way they introduce them too. Because rumor we don't go say now for tap, let them picking and get belly. So few months or years down the line, then get teenage pregnancy go up. You understand, eh? So that don't defeat the rumor hopefully pass this maclate and for later let begin to get belly infertility issues. So that is we say now because I get the beginning of the maclate and the rumor don't go say they get belly, you then go into active activity. You understand? So in the end, we get more picking than we get belly. So then they just apart from waiting people they talk say, the thing. Then like come to your question. Now in terms of information, where body information, how they get find or good information not the well body. Now that we always, say we get the 117. Where we don't promote from 10. After Ebola, we try for CC, it encompass or it gets all other components within the ministry where they don't capacitate for that one day. If they up and running, you call 117, then go talk to you. Or if not even able to give information, they can link your concern to the people level for take action. Then we know say every community now will get health facilities. You understand? Health facilities scatter all over Sierra Leone. So then they said another port of call for people who want to forget, information about well body business. They go now the facility where they near you or any well body workman because now even a community we get CHWs them. CHWs then they not the community. You understand? I don't say community people sabi the CHW them because now they picking them, now they recommend them. You understand? Then they can call them, community doctor. It is to them. So when they meet them, they give them information. And they sabi almost of them tell how they talk. Or if you don't get that kind of service, they tell themselves for go for them get information with them. But I want to tell family and say, well, body business now critical something. Not all man know everything but well body business. So you go to certain people, visit and say they close to well body, but not to understand. So go to the people where go give the right information for your well body. And we can always say, one thing for let us take action for your health, for your well body, for let get understanding, for let get the message, let get the knowledge. Yeah. So now deciding that we get the correct knowledge for take action for yourself. One, the community post within your way now well body workman. Be CHW or any other nurse. Then the facility within your or you call 117 if you can call 117.
Okay. All right, plenty thank you for the very salient response then when they give and when they make the conversation, they go very, very lively. So Fambul, when I don't hear it, that one a Minister of Information, they way in that one a community, they way in the count all news about what they happen in America, self, what they happen in Ukraine, what they happen in Iran, na in Sabi, all na in the count them. They do, but na in the count all any information, and they would tell when I say when it comes to well body business. Some of them information then we need for also consult another person. And one other person we will need for consult, now then we CHW then within the work between and then community then where we can say, this is a small doctor then or small nurse then within the community. We not ask them if that one a person they don't count that information, they don't cancel when I say now this. Also ask them for let you confirm if not true. If you also not satisfied with that information, the other answer they will give you, do you not go to the well body house, at the clinic or the hospital where they near on a community, go meet the nurse. If you able to talk to the matron safe, go talk to the matron body in charge. You say now this so thing at the area, especially about this HPV maclate where they talk about. But me now you no more able to give me the right information. So do you what you say? If you not able to do that one day, we say we get the 117 number when a free call where you can call 117 on any mobile network, whether na QCell you do, whether na Orange you they use, or whether na AfriCell, they not get for bond you top up. You top up not the bond for one self. Just take your phone and call and also ask say, now this is what here at the area, especially about this maclate or about this issue here about well body, then go there for help you. So not just take that person the information, for granted. If I say, oh yes, not true. The person here don't talk, so that we will stop for spread them wrong information and to people the way they make, they're not able to take the right decision about their well body business. So Fambul, we continue with the program, and then today we will talk about waiting the mommy and the pa or the combra them, or even the we auntie them, the we uncle them. Waiting we all need for do for protect them with 10-year-old girl picking them for let them not get this tumbuya, the human papilloma virus, we they cause one bad sickness we will call cervical cancer. And of course, before you reach that cancer stage, they would already say it they make woman they start for pull some bad water where the smell safe not really good, not really fine for you self or for even you man self. And in fact, they make some way for enjoy my man daddy business, you they feel pain. So for let you not go through all that thing then they we talk about say them picking them with them old 10 years. Government don't make them possible, so let them go take maclate so that maclate they build them soldier man then at the system at them body so that they not go get that sickness day or that tumbu day. We'll continue with the program. Amanda, we now together for answer this question here to the families to the parents them specifically or anybody with 10-year-old girl picking day under your control. How really, which message you really want for send to them with them for really take action as they listen to this program. Yeah.
We fumble them. We don't hear waiting HPV, and we don't still hear waiting will happen if person gets cervical cancer. We believe say if person sick na you host, even I say malaria, that money we go take for go buy Panadol, that net way you not go able for sleep because you get for the week for go watch you pikin. All that trauma where they face, if you make them later at 10 years, you no go face them at all. Because what can happen on 10 day, we can not reach the stage then day where we don't pass. Maclate not there again, no. We not get free prevention again, no. Now we just get for they be active, for they go for screening. And we don't want for make we begin away at the age of 10, for begin wondering, for 10 day like that day. So we they beg una mama and papa. This now for pull yagba pa una sefo because we don't give you picking this maclate so you no get for member bottom at all. And that you money we for don't use for begin go na hospital, take transport go here, and buy this medicine. You no go begin face Sunday. That money there you go put on powder thing, pan business, we go profit the picking safe. So we they beg una. Because the government, government like in citizen there. Now make through the well body ministry. It ensure say it educate everybody about this maclate and also make them available. We can make them even easy for us to attend them because they get one thing where they can do at them facility level where they call outreaches. And during the outreaches, sometimes they can go to schools them. I don't know if some of una picking them don't get the vaccines through that day. But we can go to schools them and we go maclate picking them. We don't want to make the yagba bokupa una. We get PHUs them around the area them. So we dey big una get community members them like Paramount Chief them. We don't meet Paramount Chief them and then self don't tell we say then self go use the young platform for advocates say picking them get all the vaccines including HPV. So because we see as something we go really unbug with them. If we remember Abraham so you tell we say cervical cancer na the second most deadliest in a salon. And this nothing where the ambog. You know, so we didn't talk about cancer, nothing where mona. Apart from the pain that we go feel, the money we go spend, the trauma where the way you not go face. You will not get the cancer, you self the face trauma. Because you go the wondering and you go the yakba and you self no go get sidom fine. So with the beguna, if you not get picking away all 10 years. If the picking not to you na teacher na school, you sabi healthcare worker around. Ask the healthcare worker for can now in a school. You na principal, ask the healthcare worker for can vaccinate. If you na mama or you na auntie, you na uncle, talk about cervical cancer. Because I get one colleague in our office and he tell we say, a mama die of cervical cancer. So when you hear about this vaccine, he glad because in picking me all 9 years where the vaccine just come on. And he's so glad. So when the picking 10 years and make them go take the vaccine. And even when the picking all older, I think right now na 13 year, it makes sure say the pikin go take the vaccine back during this November vaccination. So thing like that, they make them glad. That me colleague they understand wetin na cervical cancer because na him been get for take care of him mama, and he no want stand there for anybody. So we dey beg una, prevention e better pass cure because cure e go put yag bapa you. So we dey beg if una get pikin dem wey old 10 years, una carry dem go na the nearest health facility and make sure say they get the HPV vaccine. Now 1 grain shot you dey take. After that 1 grain shot day, you pikin don be protected.
Very, very brilliant. I mean, this is good. And Fambude, when I don't listen and hear everything Amanda don't say, but also Ibrahim Sori.
Email voice. You need a email voice, right?
Yes, sure.
So I know I don't go for plenty program them, be it media engagement, community, people and they ask why una so concerned about girl picking them. Why? We concerned, yes, because the well body ministry want for ensure say girl picking them na salon. All and they healthy. You understand, eh? They will be picking and they be picking tomorrow for picking people that will go take care of food tomorrow. You understand, eh? And in public health, sick like that kind of nature, you understand, because understand say the man is a getter in the passer, but not to what would they call host. The woman in a host, but the man in a carrier. That is to say, the woman in getter, then the man then they pass them from one girl to other, from one woman to the other. So in public health, the easiest way for deal with her, now for let you tackle her and the host. You understand, eh? So that means say the woman them. The girl picking them, if we see say 95% of them, they don't be vaccinated. You understand, eh? We were into this market and say add immunity. Means say it go hardly let it in circulation. You understand? Don't need nothing for let vaccinate boys. So that means the target picking away the 10 years old or even more. In that is where they do optimization. You understand, eh? So if they're picking a day, we don't target them. They don't get the market they need because there will be 2 doses. But you know, increased evidence from WHO and other people that's alone say no more 1 dose is sufficient for let we assure lifelong immunity for picking them. So that what that mean? That means say more picking go get her. You understand, eh? And if you more they say possible say give boys. You understand, eh? But with the target for the picking them, girl picking them, they are at high risk. When they say high risk, boy picking they get her, but you need do nothing. It go just get apps or what. You understand? They mean say that they even with small treatment you don't pass off. But woman they affect in human side. Where they make tomorrow for born a problem, where they make it lost in marriage, where they make it lost in connection with the family. So if we in public health, we see say we want to manage resources. What are we target? Not to girl picking them. That girl people don't say 95% don't get the market. Then we can see how they face out to other people. Let's say boys. So that may very much important for let we ensure say we picking them. We'll get our community beat where they 10-year-old now. If you get your 10-year-old now, tomorrow, now for go to the facility near you. Because that's the best thing you can do for them. And this is not the biggest opportunity and not the best strategy this for tap cervical cancer for picking them.
All right, plenty thank you, Ibrahim Sori. Honestly, one thing I don't pick up in the whole conversation is rather than the rumor way or misinformation way they out there where people and they say if you take the maclate, they tap born or they reduce the number of picking their way they born. Instead of that one day, if you get the tumbo or the cervical cancer, the possibility that you're not going to even born. So it's the opposite of it, right? Because if we say, they say woman born blind, we say they born, they get problem. That means you're not able for born. You know, so that's just the opposite of waiting people and they spread out there. So for let we not reach that stage there because everybody want for born. The pride of every womanhood now for let you born picking. You know, so we don't want to get a situation where somebody go afraid say if I take this mark later and not go born, then after fly or may go forbid it, you left for past you get the sickness, you get the tumbu, then the tumbu give you the cervical cancer, and now you not can born again. You know, so it could be a lot of disappointment to yourself. You know, so the most important thing is now for let we give you the right information, the facts where you can verify anywhere. You can like you get you picking way. You feel say you go for search now internet self, then go tell you plenty master sabi people now the internet where they talk about this. And now one thing we don't learn that Salone not the only country where they give this HPV maculatia to girl picking them. Not the only country that other country them when a big country them like where some people are waiting sabi about country and they say Rwanda and Africa. As Ibrahim Sori don't tell we then we don't even start for take this market long time ago.
So if for all the master sabi people them where they na wonder if them be no say this mark later go tap born girl picking them born one, they not forgive them. But then they give. And plenty other countries then they give. And other organizations like a WHO, as we don't hear it, when at the day before well body business, now the whole world, then self don't study this mark later, then don't approve them for say yes, a good. Even with pharmacy board, Sierra Leone pharmaceutical board, na Salonia, then self when na then you remember Friday when they say Coco Samba, not all we people I mean pharmaceutical board, they say it's not good for we. You know, when I say this kush business or them bad drinks where they can then they say no, this is not fine for we people them. So if this market here na been bad market, then people here for still say no, na bad thing. But because that did not happen, because they don't test and they don't go through different stages and don't say a good for we girl picking them for help them tap that tumbul the way they call cervical cancer. And I make with the encourage you for let una take them. Let una take una girl picking them for let them go take this particular market here. Now that's not the information we really want for pass out there today in this conversation here. So if you don't hear this information here, do you help we pass them to them comrade them, to them auntie them, their uncle that we get girl picking the way 10 years where they under them, you know, for let them take them. And like how they say, with the girl picking down 11 years, the possibility for let get the vaccine anytime soon. I mean, we don't know it when again then go say, oh Lord, do optimization, you know, for let we add the old age cohorts them like what we've been do last year instead November. We get from 11 years on to 18 years, we'll get over 1 million girl picking them, you know, but then they capital intensive, a resource intensive, and so we don't know when again such an opportunity will come. And like I don't talk previously in other programs then, for say this that market day, you they get them for free from your own end, but the country, Sierra Leone as a country, no they get them free. No more so, because we go like the other time we've been get Dr. Kangbana, we talk about co-financing in the vaccine chain. For say, Salone government, they give part of the money, whilst Gavi themselves, they pay parts to the one the way they make this vaccine here, and before it reach you for free. So not a free thing exclusively in the sense that then just they make them for free, then give you for free. Salone government, they spend money, and then of course other donors and other partners and themselves they spend a lot of money and resources for let reach you out there. So I want for let you take that as an opportunity for take this vaccine here. So as we try to wrap up the program, I want for giving the opportunity, probably 2 minutes each, for saying when like a kind of like follow we end the program, waiting when I want for the one that we listen to we for do. Okay, Amanda starts. Okay, all right.
I like when you don't talk, the meeting talk.
All right, okay, Amanda.
I'm really glad they I get the opportunity for remind una how important HPV vaccines be. As we don't say, we no one for make una sit down and wait. So say water pass carry. We no one for wait say una begin struggle and una begin strive say we need for go hospital. We don't make sure say the Papa government through the Well Body Ministry, then don't try for bring vaccines come. Vaccines where then they pay for. Vaccines were not cheap. Vaccines that we don't make free for make una get. The only money we una go spend now for take transport come on your house and go to the health facility. It is available for your children. We want to make Salone be a country way free of cervical cancer. And the only way for make we get done, now for make the picking them with the 10 year old right now, then take the vaccine. And in years to come, we go begin to see a drastic reduction of cervical cases in Sierra Leone. Because we not go see it happen today, but sometimes you picking there, they no get for the year, but cervical cancer again. Because now so we take drug polio na Salone, na small where people and begin go take the polio maclate. Now we know they see people where they say cocobin take or cocobin. Yes. So we they see people we get proper limbs and bodies and they able for move well, and we see say it help the country because women want to stand up and do more for the country, and the only way for make we do that day now we will get well body, and one of the way now for make you as mama, papa, uncle, or or big person self. You no need for be related to the pikin for advising mama for care and go na hospital. With a big una, if you know a 10-year-old child, you can just send the mommy the flyer. You can just send the mommy this radio talk show self where you don't listen to and tell them say listen to this and I sure say go help you pikin. Help Sierra Leone, help the women and help the children of Sierra Leone. Tell you pikin we all 10 year. Go na any government facility where they offer immunization service and ask for HPV vaccine and request made and give that 10-year-old pikin the vaccine. And Papa government go tell you thank you. And God self go tell you thank you for help them picking them for make them get well body.
All right, plenty thank you. Yes, sir.
Okay. So major one for say for the one way they listen on radio, they listen online. You know, I think to say this is a very big opportunity. You get the opportunity because when you get this information, I think to say you pass around, you know, to somebody, you know, we get 10-year-old pick or you get 10-year-old picking safe. You know, I think to say now a step you take for at least for let you save lives because I'm not telling a lie. If it's cervical cancer, it kill man. It kill man. I think I'm not able to explain that there. The treatment when you don't get the third stage of cervical cancer, where you treat them, you understand, where you do that pap smear. The treatment is so good, so. When they do that treatment per woman, 3 months or 6 months, you need fall a man. Each time you fall a man, it become twice, you know, riskier and painful than the original way they do the surgery. You understand? And it can even die. You understand? Because imagine the whole woman, your own side, all on scatter, all rotten because of cervical cancer. You understand? It kill woman. You understand? So with that kind of thing, so you get the opportunity, be part of the elimination strategy. Because Sierra Leone Well Body Ministry, this is a strategy for let we grab, you know, cervical cancer, and it's possible because we don't market most of the girl picking them, then the woman them, the older woman them, we only 21, 22 above on the screening, they don't put into treatment or let's say let's say treatment, you understand, because I know for say the other one because it's difficult. So I feel to say that they all will be part of the strategy for level help for level grave cervical cancer, batana salon. You self can do that. You self can take action. You do online before ever you do text. You the message on thing the way you know waiting, you know we get for do 2 more other thing and they ask questions. Pertinent questions because this thing they share and we go to back for CCA we they respond to our questions and concerns them where people get doubt or they need support, they need more information or either for linking them to services for screening or also forget the market or the picking the target necessarily. All of these things people will not get that information. But if you did that platform, you can ask questions so we can see we able to respond to them.
All right, plenty thank you, Amanda and Ibrahim. Sorry that when I don't say when I closing statement first before the question. Then 2 questions that they come in. So the first one probably to you, Amanda. For people way they go na health facility, maybe we then go na the security that they meet, then go ask and say I can't take cervical cancer maclate. As some people and they call them, you know, so then they say oh that I can't take maclate for cervical cancer, or some thinking they then. Lady then we then concern whether they do OJT or internship. Now they go ask we probably no more. You want for help from with them for say when you go to the nearest clinic or well body also near you, what side at the specific side or at the specific person where you for ask for this HPV maculatia.
All right. So when you go to hospital, ask for the immunization unit. Also, they give maclate. Just simply say I can't take maclate. And you go straight to the one and day. Then people that we go meet now, people that we don't train over and over and over. So they're well equipped with knowledge for able to talk to you about cervical cancer and even tell you about the maclate in safe. So if you want for no details about the maclate, you can go to the hospital and safe and ask say I want for no more about the maclate. Or you just carry the picking go. Tell the security say I can't take maclate and they go send you go outside the maclate people in there.
Okay, all right. So, Fambudem, if you go to the health facility, do you talk to a nurse? You know, talk to the right person for let them able to give the right information. So, probably instead of you say cervical cancer maclate, now I can't take. Just say I can't with me 10-year-old girl picking for let it take maclate. So, where they don't direct you now the immunization post or point. Now you can able to talk to the person there where you go able to understand you better because with the understand say some people they go and then they go say I can't take cervical cancer market. Maybe na security you talk to, or maybe the person back na patient. Instead of getting your own thing with the monarch, and then you go ask am for cervical cancer market, he just tell you I don't know, and then they discourage people for go, and then so Ibrahim, sorry. So in terms of the messaging them, how now really, because now they say this is very serious, like how you make mention of the people where they die. In fact, we don't get a whole topic around that. Now this program here where they say over around 300 to 400 women then they die of this sickness here. So to the health education program, how important is this, and how really when they complement or support the government for make sure say people get the right information at the right time on cervical cancer prevention?
Well, getting information at times not that easy, so we can do a whole lot. That's why we start first with the communication. You understand? We get to communication strategy, and we in our support program, for example, EPI, we know they work in isolation. We come together, we develop the communication plan, we develop the messages, and then we utilize mixed communication channels. You understand? We use radio, we use community engagement. We get CHWs them, we now foot soldiers them, we rely on for carrying messages to communities. We do the house-to-house engagement. We also use social media. Yeah, for una don't say PSI, we most of the time get very broad social media presence. We are careful also to message them pass. Apart from that back, we get some monitoring we can do for CC. We monitor what people they talk about Macleay business. We get a kind of infodemic system where they do power BI. When I should talk about, for example, infertility, we don't know, so this is more of the thing we talk about. Trust around vaccination, these are more of the thing we put it. So now based on nowadays with the come, what to messages them, we say this is what we promote. We they respond based on the rumor. We respond with fact. Yeah.
All right, plenty thank you, Amanda, and plenty thank you, Ibrahim Suri, when I join with today in the program for talk about the role of parents, them, they with family them, the mommy them, the pa them, the kumbra, everybody, auntie, uncle, anybody where gets a picking, when a girl picking away old 10 year, where they under you control, where you able for give consent for letting Macleay time. Do ya we take this as a very, very important information. Do ya yourself way, although you not get picking it where they under your control, but you don't get this information here. Help we for spread this right information here to then combine them now the community wherever you are, for letting everybody sees this opportunity here for taking 10-year-old girl picking now the nearest clinic or well body house where they near on a community, for let them make sure say then take this Macleay here. Where you go, do you talk to the nurse them, make sure say no ask you comping patient, or no ask somebody where you know say you no go for help you. Look for somebody where they inside uniform as a nurse, or the doctor, or whoever where you know say this now a well body workman. Ask them for say you can't take Macleay, and we then direct you to the post. You are able for talk to them and are free. Make sure say you talk to you picking, even if you're afraid for say hey na needle the thing go monitor me, it go hurt, I go feel pain. Do you talk to them? Let's see the need or the importance of that Macleay day where they go in body than the 1 minute or 2 minutes pain where you go feel with them pull the needle. So do you allow able for help for pass the information then right across, and allow help for prevent cervical cancer, like our panelists and don't say. We they look forward for see a Sierra Leone free of cervical cancer, and cervical cancer now something where it accumulates inside your body. You know go show today, you know go show tomorrow. Now in a very long time, maybe 5 years later, 10 years later or more, and that time you could begin to see the signs and symptoms. And now we the parents then we get the opportunity for we give that one day as a gift, a protection gift to we picking them, because until you know go there alive that 10 day without picking, they go through that pain day. I go blame you forever, say there was an opportunity of search where it be need for make use of, but you not support them for let him make use of that opportunity. They take it on what's on pass Gary. So this now the expert-led radio and live Facebook discussion series where they come up from PSI Sierra Leone through the MSD funds where we get, and of course we always there for pass the right information where we all need for take the right action, so that
be it cervical cancer or HPV or any other sickness, we go know wetin we for do once we face them kind of situations. And until we meet next week again, Friday, 3 o'clock to 4 o'clock, me na Alucious Tamba Foyle and Awan Fosi Tata. Bye bye.